Yeah, good evening. How you day? Welcome again to another session of Ask the Doctors. How are you? Where do you watch me from? The time now 8 p.m. West African time for here in Lagos, Nigeria. My name now Dr. Frederick Unuigbokhai. And I always tell you say good life in a sense. Now, this program not be only me the day here. I'll be the host, I the guest co-host. My colleague go soon join us. His name now Dr. Israel. And when he come, we go discuss together. Now, today's program we dey talk about malaria. For those who they watch me for the very first time, this program now every Sunday, 8 p.m. West African time. I know some people they here they watch me. How are you? Where are you watching me from? Destiny, I see you. Okay, Destiny, they here. I'm here. Destiny, how are you? Destiny, finally. Yeah, good evening, everybody. Where are you watching me from? Destiny, how far? So share the live. Everybody, share, share, share. And then very important, at the end of today's program, we get giveaway. Somebody sent me 5,000 naira yesterday on my live session, yesterday on Facebook, YouTube. Oyinda sent me 5,000 naira. She said, make I give five people 1,000 naira. So at the end of today's program, we go do giveaway to five people. Is that okay? Yeah, welcome. Dr. Rosemary from Abeokuta. Rosemary, how are you? Who day here? Who day here? Who day here? Good evening. Blessing. I see you. Blessing. OJ. Nero. Sunday Bella. I see you. Oh yeah, share, share. Let's get some more people here. Mrs. Chuku. Mrs. Chuku, good evening. How you day? 5,000 naira. Share reach me. Oh. No, we'll go pick randomly. We go do giveaway. At the end of the program today, we go do giveaway and then we go pick five people. No, before giveaway, one question. Why I don't watch you today because you never answer any of my question. Okay, no vex. I'm not God, so there are some questions I will never see, huh, madam. If I don't answer, you see, today is not question and answer. Today is malaria. We're talking about malaria, so I'm not answering any question that is not related to malaria. If you ask me anything today that is not related to malaria, I no go answer you. We no go answer you. Dr. Israel is in the house. Dr. Israel, how far? So I beg, no vex.
Fine.
Dr. Israel, how far now? How you doing?
Fine. Good evening.
Yeah, good evening. Welcome, welcome, welcome. Everybody, we have Dr. Israel in the house. So I beg, again, today we dey talk about malaria. If you ask us any question when you're day in line with malaria, see, we no go respond to your comment. Yeah, no vex. Number two, we go do giveaway at the end of the program. Oyinda Mola sent me 5K. Say I give five people, so I will give out the money. Not be my own, not be me she give. He say I give now. I will give now. Not be me. Then we will take questions and answers on malaria. So Dr. Israel, how far? Let's start quickly. No time to waste.
Yes, so let's start.
So tell me, wetin be malaria? Basically, whenever people hear the word malaria, they believe say malaria na normal sickness. They go tell you say my sickness na malaria. I dey always sick. Not knowing that malaria na serious medical condition. As a matter of fact, we dey call am life-threatening, meaning say e dey kill. But people just believe say malaria na just listen, wait. Somebody say, since we can't send star, give us another means to support. And blessing is Ichuku watching you from Rivers. If you want to support, just tell me. I'll put my account number on the screen and then you go make the transfer to support. God bless you. So Dr. Israel, please continue, I beg.
Okay. You don already talked on a few things when people they talk say be malaria. However, those are not actually show say you get malaria. Your body they hot, not be really mean say you get malaria. Malaria means say you are the person don dey infected with the malaria parasite. A parasite na dey infect person wey dey cause malaria, and the parasite na plasmodium, the plasmodium species. So when those plasmodium species enter person body through mosquito, through mosquito bite, then you be say the person don get malaria. the person go don get malaria. However, the person fit not just get malaria immediately. If the immune system, if the person immune system dey strong kampe, the immune system fit in one way or the other fight that parasite comot, say e no go affect the person. But some people, their immune system fit not dey too strong, and then, or not be even some people, everybody in one way or the other, one thing fit lead to something. Your immune system go drop small, then the malaria symptoms go come dey come out small small. And from there, people go come dey get different things, dey sick, and malaria don start. Na be that. So not be say because you purge overnight, you go say you get malaria, or because you cough or sneeze every moment, you go say you get malaria. It doesn't mean that you have malaria. Eh? So malaria go only come when be say you are now infected with the parasite called plasmodium. As I earlier said, plasmodium get different type, but more your liver as plasmodium. Make we not go dey talk many medical grammar.
Yeah, thank you. Okay, so somebody dropped my account details. Destiny actually got my account details. Destiny has been a good friend all the way from TikTok. She follow me everywhere. So Destiny, that is my account number. For those where they ask for my account details, that is it. And Destiny got it. Now, you get one thing where we need to know. Malaria, as Dr. Israel talk, na parasites. The name of the parasite na plasmodium, and you dey get them from when mosquito bites you. Infected female Anopheles mosquito. Now, so you dey take get malaria. Very, very important. Then okay, that for be the cause. So we don't already talk waiting the malaria and waiting the cause malaria. And the next thing we'll go on be talk about be say, okay, so how person fit take get malaria? If mosquito just bites me once, I go get malaria. Do you understand? People just believe say whenever there's a mosquito for their house, they don't get malaria. So Dr. Israel, take over, please.
Yeah, as Dr. Fred talk, he say na only mosquito, the female mosquito, what they call Anopheles mosquito, na im dey carry the parasite wey we dey call plasmodium, and when they infect person. And you should also know say not be all the mosquito fit just get that plasmodium inside their body. So na only the infected mosquito wey get that plasmodium na im dey fit transmit that malaria parasite to somebody body. So once mosquito bite you that first time, e no mean say you go just get malaria that time. Now, there are so many things when I go like talk for this place, but as I earlier say, I no wan talk so many grammar, so that make we not come confuse. But I go just try talk some few things. Wetin dey make some people once mosquito bite them, na they go think say, and they just get malaria immediately. They go think say na that mosquito wey bite them that moment, na give them malaria. Na be say when mosquito don first bite you before, the wetin dey release enter the body no be the mature plasmodium, na the small pikin. And all those small pikin go the liver go stay. So when they stay the liver, as at that time, they no dey cause problem. They no go, your malaria no go catch you that time. Now when your immune system come drop small, all those one wey dey the liver go come out, enter the bloodstream. When they enter the bloodstream, they go come dey try to complete their life cycle. Now that time, na person take dey get malaria. So if mosquito bite you today, no mean say immediately that one wey bite you today, na just give you malaria. You go know say you don already first get those small malaria pikin for your liver. Now dem come out, come make the person get malaria. So na so it dey be, because they get life cycle. And wetin we dey call life cycle, the plasmodium get life cycle. E get how e take dey waka to come turn to big plasmodium. So e must follow through that life cycle, and not be within 2 seconds e take dey follow those life cycle.
Yeah, thank you very much. If you just dey come, welcome. We dey talk about malaria. We dey talk about everything about malaria. But I won't beg you, I beg. Help us share the live stream. We dey stream on YouTube. We dey stream on Facebook. three Facebook pages and two YouTube pages right now. Now in this video they on right now. So help us share. And then at the end of today, we'll go give out 5 people 1,000 naira. Somebody give us money. Same way we give people where they listen to us today. I just say, man, let you know. Help us share. Tag your friends. So if you don't talk about malaria, talk about how people take they get them. Now, the very, very important thing where I want more to talk about today now. I see your question, David. David, they ask us some question. Don't worry, we will come to your question on malaria and fever. Make we talk about the symptoms of malaria. If somebody gets malaria, wetin the person go see for him body. Do you understand? This one, a lot of people just believe say the moment they get headache, they don't get malaria. So I'll make I start briefly, then I'll hand over to Dr. Israel again. Now, malaria gets so many different types of symptoms. You get the early symptom, the early stage. You get the late symptom. The late symptom, they very bad. See, the late symptoms of malaria, if it cause complication, if you don't do anything, the person if he die, malaria they kill well, well. So some people go get malaria, their symptom go dey different from another person wey get malaria. So e no mean say because I get malaria, wetin I get na you must get. That is why some people talk say the moment I just notice say I get body pain, I don get malaria. Yes, e fit be, but the symptoms dey plenty and different people fit get different symptoms. So Dr. Israel, over to you, please.
Okay. Now, the symptoms, signs and symptoms wey person fit get, I go just mention the one wey many people dey quick get before, when many people dey quick get, and when we dey quick see. And the person fit get, e body fit dey hot. The body go dey hot. And when the body dey hot, e no dey hot throughout the day. Most of the time na evening na im body take dey hot. The person, children, mostly children, you go notice this thing well well for children body and some adults too, some adults. During the day, in the morning, afternoon, you see say the pikin dey play. Then once e don dey near evening, the pikin body go come dey hot. You come dey moody small small. You try to comot for where every other person dey. But for adults, you go notice that. Then some of them, some persons go get cold. Their body go they catch cold, and as they catch cold, some go dey shake join am. They shake join am. Another one I be say they go some of them go get headache. Some people go dey complain of headache, say their head dey pain them, and also they go get joint pain, and their body, all their joints go dey pain them. Or sometimes the general body go just dey pain them, or their body, their muscles go dey pain them. Every part of their body go dey pain them. They go dey feel pain like that. So these one are the simple symptoms when people they actually dey show. Sometimes some people feel they vomit or get that sign say they want vomit. Some children go fit get stomach pain. Their belly go dey pain them well well. So they cry say mommy belle. Some of them now malaria still they cause that one. Then some children fit come down with convulsion because of the temperature. When their body don't too hot, they fit come down with convulsion. They go start to dey convulse. And some people go come down with shortage of blood as well. And the malaria go just suck their blood. Okay, so some people fit come down with that as well. So I think I will stop here. I think I will stop here. So Fred, if you get some, wetin just talk. This one are the ones where they say we go fit see. We go fit see in our eyes. Like you dey house with your pikin, you notice all these things. You go know say, most likely, not be saying na malaria, or it not mean say it must be 100% malaria, but most likely this person fit get malaria. So when you see those kind of things, you know say the next thing when you want to do now to carry the pikin come hospital. To carry the pikin come hospital.
If I may add something for wetin Dr. Israel talk. Now, in list some symptoms. But guess what? Whenever some people get these symptoms, they can't get abdominal pain, their temperature go up. You go here say, I get malaria and typhoid. See, sometimes or in most cases, now only malaria you get those symptoms where you think say na typhoid, now still malaria, they give you those symptoms. symptoms like abdominal pain, symptoms like vomiting, or you feel like vomiting, you understand, joint pains and the rest. Now, malaria, they give you those symptoms. Then Dr. Israel mentioned something about the blood. In severe cases, as we talked before, say malaria, fee, the parasite, fee enter blood, take multiply. As they multiply for the blood, if it destroy the blood. Now, if it is serious, the blood feel low, the person blood feel go short because of malaria. Some people say if you get malaria, their sugar, they will get low blood sugar. So we talk about the early symptoms, we talk about the late symptoms. So if you get hypoglycemia, that is low blood sugar because of malaria. If you get problem with breathing, this one too now waiting malaria fit cause. Then in the late stage, if it cause the person convulsion as we talk, if it cause the person seizure, person fit enter coma, person fit die. Do you understand? Now, as we talk about the symptom, you
If
go
people
good. Make
get kidney failure sef, because of
correct.
the shortage of the blood, the person fit get acute kidney failure.
Very, very correct. So you understand, malaria fit
And if
spoil
person get
kidney.
heart failure, anemic heart failure.
Good. So when you dey hear these things, malaria no be wetin you go just open your mouth say na malaria dey do me. Na make we dey look you dey laugh. Say you no really understand. If you really know the power of malaria, you no go dey claim am as your sickness. You no go like talk say na malaria be my sickness, because malaria fit spoil kidney, spoil heart, affect people for brain. Now, if you get questions for us on malaria, please wait. Please wait. We go take your questions. I beg, share. People are not they share now. You guys are not sharing the live stream. I dey look. Una no dey share the live stream. So let's talk about one area where they important. Now, if malaria affects woman, we get belle. Shey you know say we no wan make woman wey get belle make she get malaria, because malaria in pregnancy, e fit cause problem for the woman body, e fit cause problem for the pikin. And our people go dey use am play, think say na normal. Na make we dey beg you, when you dey pregnant, no just sit down for house, go see your doctor, make dem check. So make Dr. Israel help us again talk about some of the things wey fit happen if woman get malaria and she get belle.
Okay, when woman get belle and e get malaria, and e now depend on which stage when the woman dey in during pregnancy. We get 3 trimester. We get okay, may I call am stage, but medically we call it trimester. Okay, so the first stage, the second stage, and the third stage. That is the first trimester, the second trimester, and the third trimester. So if the woman get malaria for the first trimester, most of the time the woman fit get miscarriage. The woman fit get miscarriage. That is, the pikin go comot on its own, and the pikin fit just comot on its own. And this same malaria fit still make the woman lost a lot of blood, and all other symptoms wey we don first talk. Because once the woman lost the pregnancy, e fit dey bleed well and all that. So malaria fit cause abortion. Mo just call am abortion. Malaria fit cause miscarriage. Malaria fit cause miscarriage. Also, sometimes if maybe you don reach the third stage of pregnancy, that third stage na when you wan deliver, you go soon born. Malaria fit cause wetin we dey call congenital malaria. That is, the pikin sef, you go born am with malaria. The pikin go come out with malaria. And some of those pikin, when they come out with malaria like that, some of them fit die. Some of them fit die. Some of them fit get a problem with their brain and other part of their body later in future. Also, if you come even say make you dey treat the malaria mostly in that last trimester, even the first trimester, the drug wey you dey use fit still cause problem for the pikin. Most of the time, and you know say adults don grow. So most times the mother fit not to get too many strong problem, but na the pikin na we dey really consider. In the second trimester, the pikin, e fit affect the growth of the child, how the pikin take dey grow for belle. And if e affect the growth of the child, that time maybe the amniotic fluid, the water wey dey belle fit come dey dry, and that time you go come need to go remove pikin. That is, you don say get miscarriage. You don still get miscarriage. So these are the few things wey malaria fit cause in pregnancy. However, these things, if you register for an ten atal clinic on time, these things may not happen, because ways dey when we go fit take prevent them. And na make we dey always talk say, once woman get belle, e no suppose dey go chemist go dey buy drug by herself for malaria, make you not go buy drug when go even affect the pikin, because there are some malaria drug when, okay, there are some drug you take from when you fit take wey fit affect the pikin. Even some malaria drug dey when you fit take wey fit affect the pikin. So we dey try to make sure say those things not happen. So that's why you must, it is very important say you come and register for antenatal. And when you register for antenatal, the good thing is that we go even give you some things to take prevent malaria. We'll give you drug to prevent malaria. We'll give you in two occasion. Two occasion. Once we hear say the pikin don dey kick, we go give you. Then 4 weeks after that time, we go give you again. That one na to prevent malaria. That's to tell you how malaria not good during pregnancy. But we no dey give when you don dey reach your third stage of pregnancy, because if we give, e fit cause problem for the pikin. E fit give the pikin jaundice. So now make I dey talk about the treatment of malaria during the third stage of pregnancy. Say e no still dey too go well.
Yeah, thank you, Dr. Israel. If so may I add some stuffs too. You know, say woman we get belle get malaria, her blood fit short, and when the woman blood shorts like this, when the woman blood short, if it affect the woman, if it affect the baby, if it make the pikin, when the pikin never even reach 9 months, if you get what they call preterm delivery, pikin never reach 9 months, if you lose the pikin, or if you make the pikin not even develop big well as it's supposed to big. So malaria in pregnancy, a very big deal. And then if you be woman, you get belle, you see your doctor, and they see say you get malaria, they go manage you accordingly, according to the evidence, the standard wey dey to treat woman wey get malaria. So even if you get malaria, no mean say make you come dey fear, because your doctor go actually treat you. Shey you understand? Our job here na to ensure say you go hospital, you do the right thing with yourself, you no sit down for house. Is that okay? Now, as we dey talk again this night, if you get questions for malaria, please, we go take am at the end of this discussion, and then still help us share the live stream. Now, more we talk quickly. When somebody get malaria, how the person go take know say e get malaria? Now, by head, you go just sit down, close your eye, just say, na malaria I get, or e get how you fit take know, or you need to go to the hospital. So may I throw am again to Dr. Israel, make he just help us, then we continue.
Okay, you know, we don't mention the signs, many signs and symptoms when person fit get, when person fit get, and when go make am dey think say maybe na malaria e get. So when you don't get all those things, we expect say make you go hospital. When you reach hospital, your doctor go ask you questions. He go wan really know whether na malaria you get. So he go ask you some questions, he go do some examinations, and finally you come do test. Now when they do test finish, now we fit come talk say whether you get malaria or not. So when you do your test, the test go come show. If na malaria you get, e go show say yes, you get malaria. However, if you not get malaria, e go still show say yeah, say you not get malaria. However, there's something I still need you to know is that you still get the time when you go test yourself. You still get the time when you go test yourself, and you go find out say the thing go show say not be malaria. That is when, because the nowadays the kit wey we dey use take dey test malaria, this rapid test kit, most of them, you know, say when we start, I tell una say plasmodium get 4 species, e get 4 pikin for that group. So sometimes that test when most hospital dey use these days, the rapid test, most of the time na one of the pikin dey fit show. And except we use the microscope, the thin and thick film, now that one go come show say okay, this person get the different type of malaria. So most of the time it is better that even when they say they use that rapid, and they say, you know, they tell them may they use the microscope on. So with the microscope on, that one go really give us the real diagnosis, say yes, this person actually get malaria. So you must do tests to show say person get malaria, and that test go show positive. And if you show positive, then we can actually say yes, this person get malaria before treatment fit take place.
Yeah, thank you, Dr. Israel. Dr. Israel don't tell us how they take confirm, take diagnose malaria. No, we say you go just sit down for your house, think say na malaria you get. If you even get something else entirely, but you go they treat malaria. I don't know say na another thing they cause problem for the body. Now we want enter one very interesting area. Now this area, na area on what we dey call recurrent malaria. You know, say you get case where we say some people go tell you say that they always sick malaria. Sometimes they go take treatment, the thing no go even treat completely, or they go take treatment for malaria, e go be like say e go, e go come back. Wetin we dey call resistant malaria. Now, these things na things wey dey. Some people fit get resistant malaria, meaning say they are malaria for their body. Some of this medicine wey we dey use, if e no work, or they go take treatment for malaria, they no treat am complete, or they no treat am well, or they fit get every time they get malaria. Now, many things dey wey dey cause these things. So, I go follow Dr. Israel talk. We go break am down. If you get questions on malaria, please just take your questions down. We go soon come to take your questions on malaria. But any question we know dey on malaria today, no vex. We no go take am here, no vex. Dr. Israel, over to you.
Okay. This three term when you just talk: recurrent malaria, resistant malaria, poorly treated malaria, and they miss hand in hand. Some people fit get poorly treated malaria, they go think say na recurrent malaria. Eh? So when we say poorly treated malaria, na malaria when you not treat well. All those people when they treat malaria, you take 2 tablets, you go leave the last one. All those ones go lead to poorly treated malaria. Eh? Also, when you go take drug when supposed to be for prevention of malaria, think say you take treat malaria, e fit still cause poorly treated malaria. Also, when you not treat the malaria very well, eh? When I mean you not treat the malaria very well, all the things where doctor say you do, all the preventive step when you suppose take, when you not take, those are fit cause poorly treated malaria. But most of the time, poorly treated malaria now because you not complete the treatment when you suppose take, you not complete am, and two, you know you they give and two, drug when they take they prevent malaria, you go they say now you want use they treat malaria. Now, may I tell you now one drug will take they prevent malaria? Oh no, sorry, I want pass my boundary. Sorry. So drug will take they prevent malaria. You can't go to use, you go use and treat malaria. So those things will cause poorly treated malaria. And from poorly treated malaria, we fit come get resistant malaria. How? Because you dey use drug, you not use am well. When you wetin you dey tell the plasmodium, wetin you dey tell the parasite make e do now, make e go build strong body weight for you. So when you can't use that same drug again, e no go work. So that one will come lead to resistant malaria. So you now need another type of drug, another type of anti-malaria to take treat that malaria before e go comot, before you go fit dey cure from that malaria. So most of the time, poorly treated malaria is due to resistant malaria. Na poorly treated malaria dey cause am. So when we say recurrent malaria, in recurrent malaria, e mean say this person dey always dey come down with malaria, and most of the time our immune system still get things to play when it comes to that. Our immune system. And how? Remember say I tell una say, remember say I talk one time say when mosquito bite you, not mean say at that time now you get malaria. And I also say that small malaria fit dey our liver beforehand when they try to grow. So in recurrent malaria, those small when dey our liver when they try to grow, some go come out again, and when they come out, malaria don come. So you treat am, so the drug go kill the ones wey dey the bloodstream. So the one wey dey the liver, because e never mature, the drugs not go reach there, so e go still remain there. So after some time, when you don still get small, you don still stress yourself small, those ones go still come out. So because they come out in small, person go dey come down with malaria frequently. And you know, when mosquito still bite you, some go still go gather for there, go they wait for the next time when the malaria will come out. So that one might be recurrent malaria. That's how recurrent malaria actually they come to play. Then I don't want resistant malaria. When you not treat malaria very well, you make sure say some of the drug not they work for you, it will lead to resistant malaria. The poorly treated malaria now when you know they complete the drug when you suppose take, and they lead cause poorly treated malaria. And also sometimes if you not be saying you know they take the drug, you go meet person when you not go hospital, you go chemist, then they give you drug, the drug not complete, e not get the complete ingredients when they treat malaria, but they tell you say this drug will treat malaria. So when you take those kind of drug, because you not get the complete ingredient, when supposed to treat that your malaria, e go treat half, e go leave half. That one a poorly treated malaria. Okay, Dr. Fred, over to you.
Yeah, thank you very much. Those where they watch us for YouTube, just send wave sign. Those where they watch us for the very first time, just send wave sign. Maybe we know you. And then if you never share the live stream, you know they share, but you just want come ask us question. Nobody do be that. As you do be that now. Why you do like this? Nobody share. You no go collect anything from your body. You no go collect your blood. You no go give you malaria. Okay. Now, as we go through round up, maybe we can go to questions and then we go to the giveaway. Maybe we talk about how person fit take prevent malaria. Are they sick malaria every time? Wetin dey go on? Is it that where you dey stay, maybe you and mosquito na be 5 and 6, you dey live with mosquitoes, maybe your environment dey dirty, or maybe you no get net for your apartment, or you no dey sleep on insecticide treated net. These things fit dey cause am, or maybe even your immune system dey down, wey dey make these things just dey multiply anyhow. So you get many things wey fit make you get malaria. So quickly, make we talk about prevention of malaria, and then the treatment of malaria. And I say they will give you anti-malaria medications. They will give you the medication to treat them, the standard. So we no go tell you the drug here. We know they give medications out like that. You understand? So if you want to treat malaria, you have to go and see your doctor. Basically, what we go tell you here now the preventive steps. So Dr. Israel, over to you.
Okay. I think Dr. Fred actually talk many things to prevent malaria. And also apart from those few things, when Dr. Fred talk, I think say Dr. Fred, now person go talk about the vaccine. I mean, we go get
Yes.
some more
We
time.
can. We can. Because
Okay.
questions go enter and then give away. Yeah.
Okay. So Dr. Fred talk most things to prevent malaria already. So one, now to stay for house when mosquito not go be your friend. And how can that be possible? And try make dirty not the 2 day your environment, because now that place now malaria mosquito they try to now that they grow. Also make water where they stay one place not the day your environment as well. So stagnant water can also lead to breeding of mosquito as well. Another thing, try to dey sleep under mosquito treated net. Mosquito treated net will also prevent you from mosquito to bite you, and sometimes they even kill mosquito. Using of mosquito insecticide to kill mosquito, it will still help you to prevent mosquito. Even though you get mosquito treated net, because not only when you go sleep mosquito go bite you. Make sure say your door and your windows also get net, and try to make sure say they are all your door and the net where they your door they always dey locked, so that with those ones you will go fit prevent mosquito. Without us saying, you try to make sure say your house dey clean, because wherever they clean, dirty not dey stay, and where dirty not stay, mosquito not go dey. So also for us where they pack things where we not they use, they gather them, they keep. It is time to pack those things and throw them away, because I think when I go see no, wherever you pack many cloth from one place, go hit the place, you'll notice a mosquito go fly come out, because they get room to grow for there. So those things when you know say you know they use all those when you pack gather try if not to go dash am out go dash am out if not to go through it then go through it then if not to go burn them go burn them. So recently for some years now you need to get vaccine and to prevent mosquito sorry to prevent malaria. I want to say um, that as of today this April we don vaccine don dey wey to prevent malaria but this vaccine go prevent malaria e get 75% prevention rate and e actually meet WHO standard na make na make e dey fit use am and two country now don accept this vaccine. One na Ghana, the other one na Nigeria. After Ghana accept am, Nigeria come fit accept the vaccine. Now this vaccine is made not be Nigeria make am o, dem make am from overseas. So they don do tests, they don do trial so that make you no go talk say na Nigeria dem want for contest am. No, not be Nigeria dem want for contest am. They don already do the trial, they don already do the trial, they don already do the testing and they come see say e go fit prevent us from mosquito. E go give us 75% prevention from malaria. So this thing e dey suitable for children mainly, for children of from 5 months to 3 years. If they take this vaccine, e go actually prevent them from having severe form of malaria. And no need to come dey tell una wetin dey take make am because even though I tell una e no go make any sense to una for now, so no need. So I think that's how I will end it, that Nigeria have actually adopted the vaccine. Ghana adopted first, then followed by Nigeria. And luckily we don get vaccine. Soon we will start to dey receive the vaccine. But the vaccine no be one dose thing. E go take up to 3 dose, then a booster dose after 2 years. So to give you a 2 years cover. So na so the vaccine be. And that's also a good way to prevent malaria. And that's the one
Dr. Israel network don dey act up again. Dr. Israel, Alpha, try fix the network and then come back. So we don't talk basically wetin we feel say you need to know about malaria. Now, if you get questions, Dr. Israel, Alpha, your network dey act up. If you dey okay, let me know. Okay.
You dey hear me?
Okay, now they hear you. Welcome back. Welcome back. Yeah.
Okay. Sorry. I was saying that we don't on Tuesday na World Malaria Day. And na to remind us say malaria still dey and we dey try to fight am and we dey try to eradicate am. So also you need to know say malaria Africa countries, sub-Saharan Africa, na dey contribute the highest infection of malaria for the world, about 97% of malaria for the world. And Nigeria dey carry first in terms of that. And Nigeria dey carry first. Okay, Dr. Fred, over to you.
Thank you very, very much. Now, make we do small recap. But before we go ahead, make I thank Ngozi Amina. Ngozi Amina just sent 100 stars. Ngozi Amina just sent 100 stars here. And the rest people, they look us. You no go send star, nothing. You no go share, you no go support us. God bless you, by the way. But we want to say a very big thank you to Ngozi for sending 100 stars right now. And then we'll go take your questions, few questions, and then we'll go do the giveaway. We give 5 people 1,000 naira. We then give him, so make I give you. So, wetin be malaria? Malaria na infection, life-threatening sickness wey dey caused by mosquito, female Anopheles mosquito. When they bite you, they go give you the parasite. The name of the parasite na Plasmodium. Dr. Israel tell us we get different types of the plasmodium. Eh? So na that one they cause malaria. Malaria will not be virus, now parasite they cause them. You understand? When female infected Anopheles mosquito bites you, we talk about the symptoms. Many types of symptoms they. We talk about malaria in pregnancy, why e dey bad. We talk about how you fit prevent malaria. We talk about resistant malaria, recurrent malaria, poorly treated malaria. We break them down. Now, if you get any questions for us on malaria, we want take two. When we take two, we go do the giveaway. For those we don't know how to send stars, ask Ngozi. Ngozi go tell una for the comment section how to send stars. Make una send us star. We need it. I need it. We will not come online and form for anybody. Yeah. And if you know, say what we they do here makes sense, share the live stream. You don't need to be ashamed of it. Abi, you dey shame for us. Share, invite your friends, make they come learn. Thank you very much. So ask us your questions, and then we are going to the giveaway. If there is no question, we'll do the giveaway, right, Dr. Israel?
Yes.
Okay, let me see if we have a
But there
question
were only two
here.
questions. I thought you said there was one question. I thought you said there was one
The
question up
question,
before.
the question plenty, they up. So I would like make them resend down because to they scroll up mine. Can I find it? Can I find it? Send the questions again. What are you doing with the star? Go and search on Google. Ask Google quickly. Blessing, just go and ask Google. Google will tell you Facebook stars. Hmm? Just go and ask Google. Let's see. Don't ask us any question not related to malaria. We will not take it. Okay. See question of Israel. Will adults be given this approved malaria vaccine? No, it's not for adults.
Okay. Now, for now, based on waiting, we don't get information we don't get. Notice now this April, now Nigeria are gradually. But for now only children now we don't know say they go give. And I think I said the age 5 months to 3 years. For now, that's the age range where we don't know for now. Maybe with time goes on, they go still tell us, say, okay, adults fit take the vaccine. But for now, that's all we know. So I go see encourage us, maybe we they check, maybe they go online, maybe they listen. So that if they come to us say, adult can take, you too can actually go and take and prevent yourself. Because if the day I will just say adult go take and me go take.
Okay, before we do the giveaway, we get some comments here, questions here. This one they ask us again, how can I send stars? How do you send stars? If you're using Facebook Lights, you know if you send star. Facebook Lights, if you send star. But now only this thing. Okay, see question here, Dr. Israel. It says, what will be the difference? What's the difference between malaria and fever?
Okay. Fever, now just your body they hot. Now that one be fever. When your body they hot, now we they call fever. So malaria now be waiting parasites they cause. So and fever na symptom. Malaria na disease. So when we say symptom means say if it dey every kind of disease. Fever fit dey malaria. Person fit get fever when he get malaria. Person fit get fever when he get typhoid. Person fit get fever when he get pneumonia. Person fit get fever when he even get some infection. Even urinary tract pyelonephritis. Person fit get fever. Person fit get fever when e get accident, say e don dey short of blood small. Person fit get fever, that is a body fit hot. So once your body dey hot, na im be fever. So while malaria na disease state. I think that's the best way I can explain it.
Okay. So when we do giveaway. Now the very first giveaway, the very first one, now question. The first person to get the answer, now go collect the 1,000 naira airtime. You must be a Nigerian. I beg, we know if you transfer outside Nigeria. So, what is malaria and what is the cause of malaria? The first person to get them correctly for the comment section, when we see your answer and it is correct, now you will go pick as the winner. Then I go transfer 1,000 naira to you as airtime or to your account, anyone. Oh yeah, everybody give us answer now. The first person to get up. What is malaria and what is the cause of malaria? We don't talk Abi. Oh yeah, let us go. Sharp. No time. No time. No time. If nobody get them or nobody won't get them, this 1,000 naira will keep them. Okay. Nobody's answering. Dr. Israel, Shebi, they see the comment section, Abi.
Nobody answer. Nobody answer. Don't do yet.
So it clear. Say malaria. Okay. I'm waiting for your comments. I don't see one. The person will get them. The person don't get them. Let's start. This one says malaria is a disease and is caused by mosquitoes. The next person says malaria is a disease caused by a female mosquito. Malaria is a disease caused by a parasite. The parasite is spread to humans through the bite of infected mosquito. Malaria is a disease caused by mosquito parasites. Malaria is a disease caused by mosquito. Mosquito is the cause of it. Malaria is a parasitic disease caused by female Anopheles mosquito. Let's see this last one. The last one. Malaria is a disease state which is caused by the bite of a female Anopheles. Okay. Dr. Israel, what do you think? I think now only one person ain't they close to him.
Yes, now only one person they close to the answer. The rest not correct.
And I think this person they close, right?
Yes. Which person?
Yes.
No, not be this person. No.
Now who? Who? We are find the name. Let me see. For my screen, I look my screen. Let's see who is the person.
Now the person when I put for your screen, so now they almost
Malaria is a
close to it.
disease caused by a parasite. The parasite is spread to humans through the bite of infected mosquitoes. Okay, I like the word infected mosquito. Okay, now they close. He put the word
Now they
infected.
close.
Okay, but wait, he put infected. He no put the type of mosquito. He no qualifier. So what do you think?
Actually, now
Infected.
not be mosquito they cause malaria now. Not be mosquito they
Yes.
cause malaria. Mosquito now only the person. Now only the we they call them vector. Mosquito is just a vector when they carry wetin they cause malaria.
Malaria.
We
Infected
even talk wetin
female
they cause.
Anopheles. Infected female Anopheles. Now they carry that parasite.
Now they carry the
Ah.
parasite when they
Mm,
cause malaria. Answer don still come. Not worry about that one again. Answer don come.
no, this one they listen to us. They give us answer now. They listen to us. They give us answer. No.
No, now we not mention anything. We not mention anything now. We've not mentioned
Okay.
anything.
Okay. So let's see which one. Let's see which one. Uh, Malaria is a disease caused by a plasmodium parasite transmitted by a bite of female Anopheles mosquito. I think okay, infected any type of. I think okay, caused by a plasmodium parasite bite of female. Okay, I think this is the closest. The
Yeah,
wait oh
this is the closer. In fact, this is the if this person, if I see this one for exam, I think give this person 6. Then I will give the other person wey talk say it's caused by parasite. I go give am maybe 4. The reason because this one mention the parasite when they
yeah
actually cause am.
correct yeah. See somebody don't come talk pause so hey see wetin us. Okay, somebody is asking us, is my answer not correct? Caused by a parasite that commonly infects a certain type of mosquito which feeds on humans. You didn't mention the parasite. So the person will get am na confidence. She mentioned that plasmodium. plasmodium parasite transmitted by the bite of female infected female. So now that word remains. So room confidence. You got the
That
answer.
plasmodium parasite is actually what causes
Yeah,
malaria.
the
The
plasmodium, the
plasmodium species.
plasmodium.
Now they really
Yeah.
cause malaria. Only that
So
plasmodium species you go fit see am for Anopheles mosquito. So mosquito just be the carrier. Now you're the carrier up and down.
so you see this comment here, my guy, you are very wrong. I beg you in the name of God. This was not what we said. Mosquito bites and cockroach bites can cause malaria. I beg you. This is not what we said though. I beg, I beg, I beg. So confidence, please drop your phone number or your account so that we can transfer to you 1,000 naira. Oh yeah, confidence. Quickly, may I give you the money where then say make I give you? It's not my money, oh. Uh-huh. Oh yeah. So let's go to the next one. Dr. Israel, do we do a draw or we do another question? What do you think?
We don't finish with that question. So if
Yes.
we may do another question or you do any other game to see
Let's
who will win the other one.
for like do like a raffle draw, but what do you think? Some are getting it from Google, no problem.
Okay. So somebody don't put one lovely thing, but sorry, we'd already passed that answer.
Yes, yeah, we don't pass, eh? Okay, good, good, good. So I'm waiting for your answer or your comments. Confidence. If you are in Nigeria, please drop your account or your phone number so that we send you. Okay, your phone number. Is which network is that? Quickly, which network is that? Which network is this? So put the network 0701086. Okay. So no, we pick. And so let's do a draw. Let's pick a draw. Hmm? To qualify for the draw, you have to put exactly what you see on your screen. Anything you see on your screen is what you put. So we're going to pick somebody. Um, this is what you are to type in to qualify. Hmm? What network is that? Yeah, let's go quickly, quickly. There's make I give you the money, so we the which network is this? So oh yeah, enter what you see on the screen to qualify. Let's see, only one person. Oh yeah, let's go. Confidence. Which network is this? Make I send and give you quickly. Oh yeah, let's go quickly. Only 4 people don't enter. Hey God.
We reach we reach 10. We can.
Yeah. Confidence. You're not responding to me. Which network is this? Okay. Don't put in your number, blessing. I didn't send it to put in your number, eh? I beg. If I don't tell you to put in your number, don't put your number, eh, my dear. Make I delete your comments. No vex. Confidence. Enter exactly what you see on the screen. Oh, okay. Should we pick? We have 16 people and we have 44 looking at us.
We have how
Con-
many?
How many people already now qualified? We have 16 in. Should we pick?
Okay. No, do the 16. Let's do the 16 and
Okay. So let's pick someone, eh? Let's pick. Let's pick.
yeah.
Confidence. Which network is this? So who's the winner? Juliet Ukachi. Juliet Ukachi is the winner. Okay, so the Israel question.
I bet when they put it this thing, we don't finish. We don't want that again. We've already done the draw.
Yes, we
And
don't want
Rita,
that
thank
again.
you, but we've done the
We've
draw
done the draw.
already.
Juliet Ukachi is the second person to get the 1,000 naira. So, Juliet Ukachi, drop your phone number or drop your account details. Anyone. So, Israel, do we pick? Do we pick? Do we do another draw or we do a question? The network is Airtel. Okay. Send the number again. I've been waiting for you since. Okay,
Okay.
send it.
Who
Okay,
be
tell
the
me, tell
first
me, tell
person
me.
will join us? Who be the first person will join us for this live, sir?
My guy, no idea. Oh, I swear. Now the first person we forgive. Oh, we forgive the first person that
Okay,
entered
there's
this
no
live
way
stream.
there's no way we can know the first person.
Yes. So Juliet, Ukachi, and Confidence, send your okay. Same will do question. Okay. But yeah, Mo ask question again. So I'm gonna put in another question now. And then the question would be this. I have the question, Dr. Israel. So I'm typing a
Yeah.
question here. The second question. What is the let me see. Okay, good, good, good. The person that gets this one correctly, the second question says, no, not this one now. Hey God. Yes, this. What is the complication of malaria? Tell us. If you just list, we go know. Hmm? If you just list, we go know. Oh yeah, tell us the complication. 70. Oh yeah, we want to give
Juliet, don't
the
drop
top.
your account number.
Yeah, yeah, I don't see So I'm sending the 1,000 naira recharge card to Confidence. Yeah,
Then
1,000.
1,000 naira to Juliet Access Bank.
Yeah. Oh yeah, somebody should give us answer. What is the complication of malaria? So Juliet, no, Confidence. I don't send them to you. Now, person give me the money, say make I give you. So let's do transfer. This is what Access Bank. Okay, I think this bank is better. Self. Oh yeah, tell us the complications of malaria quickly. May we give you 1,000 naira. Juliet Ifewewa, yeah, Ukachi. Okay, 1,000 naira from Ask the Doctors. Okay, 1,000. Juliet Ifewewa Ukachi. Okay. Oh yeah, tell us the complication of malaria. Complication. We listed the complications and nobody's getting it. So we're going to keep that 1,000 naira if nobody gets it. Wait, it's not going. It's not going.
In
Okay.
August.
No, go. I'll do them again. Okay, so people are not listing the complications of malaria. Okay, let's see. We have one here. This is the first one that says liver failure, jaundice, yellowing of the skin and whiteness of the eyes, shock, a sudden drop in blood pressure, pulmonary edema, a buildup of food in the lung. You go copying this one online. Full
You go
stop.
copy am for online.
Sorry, we didn't give it to you. You copied online. We know this. Complication of malaria, fever, constipation, headache. No, these are not complications of malaria.
That are
Uh,
signs of malaria.
uh, these are signs of malaria. Let's see.
Some people say death.
No, that is not complication. That one are ultimate. Yellowing of the skin. Hey, my God. And whiteness of the eyes. No. Liver failure for adults and jaundice for babies. Oh, my God. Let's see. Stomach discomfort, weakness of the body, temperature, bitter mouth. No, these are not complications. We listed the complications of malaria. Abi, we know Duam, Dr. Israel.
I'm not sure say we do am.
I listed the complications now. I listed them all.
Eh.
I talk I talk more. I talk more. I deliberately I mentioned it all. I'm just waiting for the very common one. There's no complication of malaria, but see, there is no complication of malaria, but jaundice can be. Hey, my God, my God.
I bet there's complication of malaria. Oh.
Make I talk and we said this now. Doctor Israel, you mentioned something now. You mentioned this too now. Hey, God, you mentioned something
Yes, we
about
mentioned them.
yes
Okay,
now.
somebody is saying something now.
Yes, I'm
Chidima.
seeing. Let's see. Is it Chidima correct? Yes. Shock, kidney failure, low correct. I mentioned this. Yes, I mentioned this. Yeah. This is the most correct answer. At least for here.
So I
For
think
here. Okay, it's not one. Okay, Frank said it's not one. There is okay, not one. Okay. So what do you think, Dr. Israel? This is the closest, right?
this is the closest. That Chidima,
It's the
I
closest.
think we
So
should leave it. Yeah,
okay,
I think
so
we should leave it for Chidima.
Chidima, yeah. You got it correctly. Oh my god, waiting they happen now. Okay, let me write these numbers down. These account details. So Juliet's own is not going. I don't know why. I don't
If
know
it's
what's
not good,
going.
it should give you phone number now. So you send it to the phone number, or if you want to give you another account number details.
No, I
Okay,
think so. What
sorry.
I'm
Frank, Vivian, Confidence, Dave, when I not verse, we'd already pick. We'd already pick
yeah.
who we want pick.
Yeah, Chidima is the correct answer. So Chidima, please drop your account details. Chidima Chibike, please drop your account details. So Dr. Israel, the next one, that's the fourth person. Do we do a draw or we do question?
I think we should do question again.
Oh yeah, what should be the question? Make I type them quickly. Oh yeah, Dr. Israel, tell me. That's the fourth one. Quickly, so that we are done. We're done. Time don't go. God.
Prevention.
Okay, prevention of malaria. Tell us the prevention of malaria. Ma pin am for screen. Okay. Prevention of malaria. So tell us how to prevent malaria. Chidima, drop your account details or your phone number quickly, quickly, quickly. Okay. OPay accounts. OPay. Okay, let's try and see if this would go. I've seen that. Somebody should tell us. Also, Israel, please, we'll be looking at the prevention though. Okay, let's see which one go. Which one went? I don't know which one. Okay, it was
How many
the
prevention will take? If you give us just one prevention, should we say that's correct?
no, it's not correct. We listed about four. So if you
Okay,
give
so
us,
person
let's
if you
say,
give us like three.
yeah, so if you give us like three. Hosanna Chidima, is that your name? Hosanna Chidima.
Chidima don't drop your phone number.
No, now in OPay account with that. Okay, Dr. Israel, please, are you looking at the screen? Phone number Chidima or OPay. List the use. Dr. Israel, look at it, please, I beg. 0160467
I didn't look at.
Okay, so Hosanna Chidima, that is it. I'm transferring to your OPay account 1,000 naira. Hey, it's not going again. Let's say transfer no dey work. Let me take your
You
number.
sure say now be your transfer not the work.
The phone number airtime where I send it go 081 606 0 one. And this one they tire me for all these things. Okay. Dr. Israel, please
Okay,
pick,
Dr.
pick,
Fred, I
pick, pick,
think we will choose between. I
pick,
think we'll
pick, pick.
choose
I beg.
between Oluchi Barak or Confidence again.
No, no, we can't pick confidence
The,
again.
we cannot pick Confidence again. The others are giving us like the Odachi Ame. He gave us just two. We said at least three. Kemi Kemi do breaks his own into different page. He gave us two as well. So it's only Barak that gave us up to four. Prevention, avoid dirty environment, avoid dirty water. That dirty water, I don't understand. Sleeping under mosquito net and feed
Okay,
well to
Chidima,
avoid low immunity.
the airtime don't go. I've sent you the airtime. Yeah. Okay, Juliet. Okay, Juliet has sent us. Juliet, send me your number. Transfer is not going. Let me send airtime, I beg. Airtime is going. Okay. Oh yeah, Dr. Israel, please speak. Dr. Israel, please speak, I beg, I beg. Let's do an end there. Receive, doctor. Okay, receive. Yes, receive. Chidima has received the airtime. Thank you. Juliet sent
Okay,
the
I don't choose.
prevention, avoid dirty environments, avoid dirty water, sleep under mosquito nets, and feed well to avoid low immune system. Very correct. Very correct. Okay.
Okay,
And I guess
some
now
of
she
us are correct. However, we say the first person to get the answer, and the rest
that's
of
number
us we dey
4.
correct, but we say the first person to get it.
Yeah. So let's do the last one as a draw, as a raffle draw.
Yeah.
So let's
So that
let's
we
do
can
let's do it
end
like
the
this.
line.
Yes, so we can end the live. I beg, I beg. Let's do it like this. Okay, good. This is good. Yeah, I prefer this one as let's do this like this. So you will enter exactly what you see on your screen. Yeah, enter exactly what you see on your screen.
Olushi,
And
abeg send your phone number. Olushi, please send your phone number so that and the network so that Dr. Fred can do the needful.
quickly, yeah. So this will be for the last person. Enter exactly what you see on the screen. For the last person, let's pick. Okay, all Juliet has
Okay,
sent her number.
yeah,
Okay, let's see. Enter exactly what you see on your screen.
one
Let
person has
me
entered.
Yeah, let's see.
Two.
Let me pick. So I'm copying your number, Juliet. 400-985-43-985-43. How many people don't enter the draw? How many people? How many people?
I think it's six, seven now.
Okay.
Eight, nine, 10, 11. If we get
Oluchi
like 20, we
Barracks.
stop.
Oluchi Barracks, please send your number. Oluchi Barracks, I'm waiting for you. Oluchi Barracks. Okay, Glow.
Yes, you
I've
don't
seen it.
send down and glow.
Yeah,
How
Glow. I've
many we
seen it.
don't get now?
Four. We don't send for now. The last person we won't give right now.
No, no, no. How many numbers we don't get for the draw?
Check your screen. No, I really don't know. I want to transfer to. Let's see how many numbers do we have here.
Okay, it's 13.
13. Oh yeah, now
13.
let's get more people.
Let's get like, okay,
Okay. This money where they send, no be me get them now. Somebody for my live session. Oyinda. Nine say I give una. Don't give me your number, if I did not tell you to send your number. So Oluchi Barracks, we have given you the 1,000 naira. Congratulations. Yeah, congratulations, Oluchi. Yeah. Now Oyinda for this Facebook live. Nine send the money. Say make I give una. Hmm? Don't put your number here or I go
okay, we
delete
have
call.
15 person now, so you can do the draw.
Let's pick, right? Okay, 15. Is anybody still entering? Received.
Barak
Okay,
have received it. Thank you.
let's see. Okay, Oluchi has received it. Thank you very much. Congrats. Okay, let's do the draw and let's pick the last person. The last person for today. Who's the winner? Who's the winner? Who's the winner? Who's the
You
winner?
must
Who's
not
the
pick
winner?
Oluchi again. Oh.
Blessing
Blessing
OJ.
OJ.
Blessing OJ.
Blessing OJ.
Congratulations. Please
So please,
drop
please send your
your
details so that we will
your
know who
phone
we are
number.
calling.
Blessing. Yeah, send your details. So we are done. We are done. We're done. We're done. We're done. We're done. This is the last person. So let's give you your airtime. Blessing. Which network? Okay. Blessing. Congratulations to the 5 people. Thank you very much. It's not from me. Now somebody here online. Nice thing we give you. So thank you. Dr. Israel. Anything again? Quickly as we round up. Somebody asked us a
Okay.
question. Says in they always fall sick and in the AA. Why? Yeah, on malaria. Why?
Uh, I believe say if you keep your environment clean. You may not actually fall sick always, but sometimes some people are just like that. They fall sick. Me na AA, but I know they fall sick. I hardly fall sick of. I hardly had malaria. So we will not want to say because you are AA, that's why you are having malaria. Yes, we know that. Yes, the plasmodium may strive well in AA. Yes, they strive well in AA, but if your immune system is strong enough, I don't think you fall sick.
Okay. Yeah, received. Thanks to the giver. Okay. You have received. Let's send to the last person. Let's transfer to the last person. Let's transfer to the last
Blessing
person.
OJ is the last person.
Yes, I've sent to Blessing. Thank you. Blessing, confirm quickly. I've sent to you. Confirm.
And that's the last
Um,
person. This Esther, please. More una not they do wetin we not send una abeg.
okay, very good. Now, this money where we give now, somebody nine supports us. He no give me the money. He send out to my account and say, "Man, I give for people I don't give them." So nobody say I get 1 naira. Do you understand? I don't even get bank charges, but I'm giving it out. So please, and then we always beg you, say make you help us share the live stream. You can send us stars. That is how you support us. Encourage your friends to come and join us. That is how you support us. You understand? And we appreciate you very, very well. Also, Israel, any final words?
Okay, I want to say a very big thank you to everybody who come here today to join us on this live. Also, big thanks go to the our donor wey make us fit play this game to give some people money, some people gift today. Very big thank you to you, and God will bless you more and more. So as una take dey follow us all the time, we pray say anything we una want, God will still do it for you guys. Also, more una remember say our things here na just is just for the purpose of education. We are not here to treat anybody. We are not the author of all knowledge. So sometimes we may say some things we may not be 100% correct. However, you need to still check. That's why you must go to the hospital when you have issues. So you go to the hospital so that they can treat you and give you the best treatment. All everything we do for you is all about education, and that's all.
Yeah, thank you so much, Dr. Israel. One thing again, we have to like add, in case we no read your comments or your questions, I take your name, beg you, no vex. You get some questions where we no go see. No matter how many times you send them, this is social media. It get what they call algorithm. It go block your comments. So we know they see some people comments, now make us know they respond. No vex. We go try our best to take respond to you next week Sunday we go do question and answer. We no go teach. So any question where you want, by the grace of God, next week Sunday 8 o'clock we go come here and we go try our best to answer your questions. Remember, we know they do private chats. We know they give number to call us. We know they do I want ask you question for your inbox. I know they do Dr. Israel know they do. But if you really, 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 really say you go follow me talk or you want follow and talk, you go book for consultation, you go pay. Better still, we go beg you, may you go follow your doctor talk. Here you get. We they do this one to create barrier, boundary, so that everybody go respect each other on social media. Now make we they do no vex. Here not to educate you alone. And we thank you very, very much for your time. Thank you for joining us. Like I always talk, good life now waiting. Good life.
That's sense.
Good life in our sense. Take care of yourself, everybody, and have a wonderful evening. Take care and bye bye.